All right, let's do an epilepsy case. Again, this case is purely fictional. So if you or someone you know sounds like this, it's probably because it's a common case and otherwise is purely coincidental. All right, let's say we have this 65-year-old man. He comes in because he is feeling some numbness and tingling on the right side of his arm. And also his leg. It initially started in his arm, now it's progressing to his leg. He sometimes has involuntary movements. He's not quite sure what to call them. He's woken up more than twice this week with feeling confused. He's bit his tongue in his sleep. He's wet himself in his sleep. He unfortunately lives alone, so there's no vet partner to tell us if there was any witness seizure like event. He otherwise has no history of seizures, past medical history, diabetes, hypertension, high cholesterol, but no seizures. So you scan him and you find this. This is a lot of swelling and edema, likely secondary to some kind of brain tumor. And his EEG doesn't show spike waves or seizures, but it shows left temporal rhythmic slowing, which we call TIRDA. It is pretty specific for epilepsy. So what do we do now? He does have epilepsy. It's secondary epilepsy, secondary to a brain tumor, which means the cause of his seizures that he's having, which are likely focal aware seizures that are becoming tonic-clonic. And again, he lives alone, so we don't know how often this really is happening because he might be losing consciousness for some of it. So history is a little limited. But in the case of a brain tumor, you do treat with a focal seizure medication, but you try to get rid of the underlying cause. So now he has to have an opinion with a surgeon and an oncologist to see how we can treat that brain tumor because realistically, you can throw all the seizure medications you want at it, but if you're not going to treat the underlying etiology, his epilepsy will not be controlled. This is unfortunately something we see a lot in clinic. Someone comes in, they're otherwise healthy, and they start having new seizures. And that's why scanning someone's head and getting an EEG is always very, very important, not only for the diagnosis, but for the treatment.